What's up, everybody? Welcome back to the Injuries Explained project, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on all their treatment options so they can have the best possible outcomes without ever having to resort to pain pills, injections, or surgeries, which only make things worse. My name is Dr. Matt Maggio. Thank you so much for stopping by and checking out the show. Just a quick disclaimer before we get started. All of the information presented in this episode is strictly my opinion and in no way, shape, or form should be misinterpreted as concrete medical advice or recommendations. If you're currently injured and in pain, please reach out to a qualified medical practitioner for a full diagnosis. If you've already done that, you're frustrated as hell, you just want to know exactly what's going on and get your problem moving in the right direction, you can reach out to us directly and request an injury consultation. All of the information for that is available in the show notes or wherever you're consuming this episode. Now that we got the boring stuff out of the way, let's get into the show. Will traditional physical therapy fix an injury? I wanted to define what I consider traditional physical therapy because a lot of times I get a lot of hate mail from physical therapists calling me names and telling me that I'm a jerk and they feel bad for my clients and patients because I'm not doing the skills that they're doing. That's just their own internal stuff. But for definition and kind of have the context for this show, this is what I define traditional physical therapy. So I say their primary, which is their main treatment modality, would include exercises and some stretching. That's what I would say traditional physical therapy is. Like, they want to do exercises and they want to stretch. And then they also do what's called like a passive modality. Passive modality is something like where the patient itself doesn't have to do anything but just sit there. This could be heat, ice, electric stim, ultrasound, some cupping, and dry needling. So now that we have a definition of what I consider traditional physical therapy, we can have a better context to answer the question of this episode. Will traditional physical therapy fix an injury? Well, the answer is no, but it's not a flat out no. I do believe that it can definitely be an important part in the process of fixing the injury, but it will never fix it by itself. If it's the standalone only treatment that's going on, it tends to be what happens in the injury world. You know, maybe someone hurts their shoulder, they hurt their back, they hurt their neck. They go to their regular doctor. Their doctor says take some anti-inflammatories and go try physical therapy because it's covered by insurance. People are like, okay, it's covered by insurance, so I'm just going to go. And they really don't get any better, but for some reason it's been like the standard of care and the go-to. And if it's helped you, that's awesome, but there's so many people it hasn't helped. So I get people that reach out and say messages like, I can't believe you're bashing physical therapy because, you know, it helped me so much. I'm like, cool, that's awesome. And I'm sure it does help some people, but it doesn't help everybody. And when it's being prescribed as the number one go-to modality and it's not fixing problems, that's an issue for me. So like I said before, it can definitely be an important part of the process for fixing the injury, but it will never fix it by itself. I'm working on trying to be nice and not talk shit on certain things, especially on the internet, because people get really triggered or offended, all that kind of stuff. So do I think there is a place for physical therapy? Yeah. One thing where I think PT can be very useful for, is going to be rehab after surgery for sure. See, I'm not that mean. I can be nice, but there's a big but here. If you listen to the last episode 4 of the project, I went into depth about why surgery usually isn't a good option. So there I go again, back to being a jerk. Sorry. So what I want to do next is I'm going to get a little bit nerdy about some things, and I promise to keep it as simple as possible. There's an order of operations to fix an injury. It's like the steps we must follow. And when it isn't followed, it would be like trying to put a roof on a house before ever laying down a foundation and putting up the walls, it would all collapse and you would have to continue to start over and over again. That's what I believe is happening when traditional PT becomes the first treatment prescribed, which is pretty much the majority of every situation. So there's this very basic idea, because we all know complicated issues like injuries just need a simple fix. And if you're not picking up on it yet, I'm being rather sarcastic and kind of brash. That if something is tight, we must stretch it. And if something is weak, we must go ahead and strengthen it. Simple enough, right? If it's tight, stretch it. If it's weak, strengthen it. That's a problem. That's a true sign of a lazy and lousy practitioner. We must be able to answer the question of why it's tight and why it's weak. It is the most important question to ask and answer. And this only comes from a detailed injury history and an evaluation, which, in all honesty, most practitioners, they just do a half-assed job at it and they do it very quickly, or they have to do it based off what the insurance company will reimburse and pay for. It's a very cookie cutter approach and they never really know what's going on. And I always say, how in the hell can you fix a problem if you don't know what it is in the first place? I'm not going to get too ranty on that, but I could go all day on this. So like, imagine bringing your car to the mechanic because it's having issues and they don't run any diagnostic test to see what's going on and they just start hammering away on it, whatever they do. You wouldn't go for that. But that has been the standard in the medical system for injuries for years. I got another quick family member story. I won't say who it is because I'm sure they listen. Another family member of mine, they've been dealing with an injury that's been going on for some time now. It's been, I think, like 6 months or even a year. And eventually they wanted to get an MRI done to see what's going on in there. They're actually in healthcare themselves, so they understand the importance of knowing what the problem is. And they wanted to have it go through their insurance. You're like, hey, I get it. You got insurance. You want to be able to use it. They were told by the imaging center that they wouldn't approve it until they've done at least, I think, 4 to 6 weeks of physical therapy. The response of this family member was great. And they said, how can I start a treatment regimen if we don't know what's going on in the first place? Bingo. They get it. But it's frustrating. I get it. You're frustrated. I'm frustrated. Medical system sucks, but we got to play it how it is and try our best to be an advocate for our own health and our own figuring out what the problem is. That's what this project is about. Helping you get better educated and informed so you can make better decisions. So now back to that order of operations stuff. I really covered this in depth in episode 2, the idea of like scar tissue and the treatment and all that. So we'll just dive into that just a little bit more. Step 1 in an injury is you need to restore the range of motion by getting the tissue healthy. Basically, I talked about scar tissue and the idea of how to get that fixed, proper depth, proper tension, all that stuff, get the muscle healthy, because if you try to strengthen it or stretch it before it's healthy, it's counterproductive. It's not going to do anything. Step 2 is where you need to balance strength. So a lot of times there's a lot of compensations in there. When the tissue's bad, some muscles overwork, some underwork. We need to get them back up on par into place with each other. This can definitely be something that a traditional physical therapist can help with and be a part of once that range of motion is restored, once that tissue's healthy. So like I said, if you're starting with a physical therapist and they just get you into stretches or exercises, but they didn't clean up the tissue, it's going to be counterproductive. It's not going to fix the problem. It's like putting that roof on that house before putting the siding and the foundation. It's all going to collapse. And then step 3 is increasing strength. I've talked about this before. That's like, once you get the tissue healthy, once you clean up the compensations, then you just need to do more global movements and basic movements to build up the strength overall. Once again, that can definitely be done by the PT once the range of motion is cleared up and the strength is balanced. So now, can we finally answer the question? Will traditional physical therapy fix an injury? No, not when it is the first option. But definitely after the tissue gets healthy. It can be part of the process. So I'm a big analogy guy. I use analogies all the time with my own patients. It really helps to kind of simplify things, because nothing makes me more pissed off than when someone's in the medical profession and they use all these big fancy words and they like to pretend how much smarter they are than everyone else because they have a doctor in the front of their name. I am not one of those people. I understand being able to communicate effectively in a knowledgeable way without talking over people is really good, and that's what I'm trying to do. So think of an injury as a cavity in a tooth with lots of plaque around it. Yeah, pretty nasty, pretty gross. Stretching and strengthening are like brushing and flossing. Very important. But once the cavity sets in, no amount of brushing or flossing will actually help and will make it worse. That is what it's like starting with traditional physical therapy, as I defined earlier. So a couple action steps for you. Number one, for sure, if the injury is chronic and imaging hasn't been done, and I'm talking like advanced imaging, like don't get fooled into the idea that they can see all sorts of shit on an x-ray. So many doctors just perpetuate, that's a big word, perpetuate nonsense about this idea of all these things they can see on x-rays. It's got to be advanced imaging like a CT or an MRI. I think I'll cover that more in depth, the difference between an x-ray and MRI. That'll really help people understand better about like what's going on. And if it hasn't been done, any imaging, definitely push for that over and over again. You have to continue to push. I said before, you have to be an advocate for your health because no one cares more than you will. And in all honesty, get to a provider that can actually answer why the area is tight and why it's weak. And if their first step is just to start off with some exercises and stretches, don't even bother, because not only will it not fix the problem, it's going to delay the window to get the tissues healthy and fixed before it starts jacking up your bones, the cartilage, the discs, and the tendons. That's all I got for you guys. Please support the show by sharing it with others, or I guess giving it a review, all that kind of stuff. It's new in the process here. I'm just getting into all this. So yeah, if you can share it with others, support the show. And if you're looking for some real answers about what may be going on with your own injury and you're just tired of getting jerked around by the medical system, then please reach out and request an injury consultation with our team. All of that information is available in the show notes. I appreciate you guys listening, and I will see you on the next one. Bye.